Today we are going to study about leprosy. Leprosy. Okay. Now, what is leprosy? It's a disease, DACAC disease caused by COSCD by PY by Mycobacterium, leprae, leprae. So, firstly, about the Mycobacterium leprae, you have two types of leprosy. Two types of leprosy. Leprosy. By the way, leprosy involves skin and bone, in the bone disfigurement. This is the oldest disease. It is one of the oldest diseases. It is one of the oldest diseases since humanity. It is one of the oldest diseases since humanity. Okay, so we can talk about the two types of leprosy. First is the lepromatous leprosy. Another one is the tuberculoid leprosy. Another name for lepromatous leprosy is multibacillary leprosy. And another name for this is tuberculoid leprosy. Okay, now we have to talk about the differences between the two. What are the differences between the two? Differences. DIFFERENC is differences between the two. So we'll just say multibacillary, BACILLARY, multibacillary, paucibacillary, BACILLARY, multibacillary, paucibacillary. So we can just draw a line. So multibacillary, what happens is, occurs in people with good CD4 T cell count, COUNT, T cell count. This occurs in people with poor CD4 T cell count. Bacillary load, BACILLARY load, LOAD is high, HIGH high. Bacillary load is low, BACILLARY bacillary load is low. Okay. Then next thing here is skin lesions, LESIONS, skin lesions, RARER, less than THN than 5 micrometer. Here skin lesions, LESIONS lesions are more than 10, okay. Skin lesions are more than 5, less than 5, and here skin lesions are more than 10. After that, there is this is nerve involvement exists, nerve involvement exists, multiple nerves are involved, here VS is involved, IN, VD involved, multiple nerves are involved. Here no multiple nerves are involved, little nerve involvement. Also, smear test positive, smear test negative, smear test negative. These are the differences. between the two. We can check from Pura Shastri if you want. If it occurs before treatment, if it occurs before treatment, TREATMENT, if it occurs before treatment, then it is progressing towards lepromatous leprosy. If it occurs after treatment, then it is tuberculoid leprosy. Okay. Then here there is interferon gamma, interleukins, and interferon alpha, and interleukin alpha, and interleukin beta 2. Here it is mostly like interleukin 6, interleukin 7, interleukin 1, and interleukin 2, interleukin 2. You see. Here it gets treated by glucocorticoids. Here it is treated by glucocorticoids. It gets treated by glucocorticoids. Here it gets treated with glucocorticoids too. Glucocorticoids and other drugs such as thalidomide, clofamizine, and antipyretics, clofamizine and antipyretics. Another complication of leprosy would be deformities, such as have wrist drop, the ropey wrist drop, foot drop, the ropey drop, hand clawing, CLAWING, hand clawing, and foot clawing, CLAWING, foot clawing. These kind of things would be the deformities. Okay. Alright, done. Then you have lab diagnosis of leprosy. First is staining. For staining, we use Zeden stain with 5% of H2SO4. We use Zeden stain. Okay. Then stain where you will see like colonies, COLONIS, pink in color with club shape pattern, PATT, and club shape pattern. Then you have culture, CULT culture. You will have the Weinstein-Jensen medium, LJ medium. You will have for leprosy. You also have the main lepromin test, TEST test, and slit smear test. What happens in slit smear is that the person will take a scalpel. Okay, we didn't see the sample. Sample has to be the lesions, the papules, PAPULES, the papules. Anything can be the lesions. Okay. For sample collection, CULLECTA, sample collection, we have slit smear test. A person will take a scalpel, they will make an incision of 5 mm. They will make an incision of 5 mm, 5 millimeters incision, and then they'll make another incision, transverse to that THAD incision, transverse to the incision, while WHILE, while pinching the papule, PAPULE, while pinching the papule. What happens here is, firstly a person will take I'll explain it one more time. Okay. For sample collection, firstly we do slit smear test. Okay. Slit smear test, TST test. What happens here is, in a leprosy patient there are going to be papules. Okay, there are going to be like these papules are going to be there, these papules are going to be there. We'll take a scalpel, we'll just do an incision here, and then we'll do an incision transverse to this, we'll do an incision, okay, so that like this full we can cut. We want the base, of the subcutaneous tissue, we want the base of subcutaneous tissue, we want the base of the subcutaneous tissue to be there. So we will do this, we'll take this, and while pinching, we need to pinch, the physician needs to pinch the like papule, and he will take it up, and he will like cut it off. And then what will he do? He will check it for CDI. CDI means cell count. If cell count is high, or the slit spray test is positive, it is multivascularly. If it is negative, it is paucivascularly. Okay, this is this much. The lepromin test. You have early lepromin test, and late lepromin test. Early lepromin test is also known as Fernandez test, and late lepromin test is known as mid-soda test. Okay, so in early lepromin test, what happens is you have to check for the induration. You have to inject toxins, like leprosy toxins, 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 toxins. I'll just delete this once again. Delete. You have to give lepretoxins. After giving lepretoxins, what happens is you have to check for induration. Induration means check for a small mass, check for papule, check for something like that. Induration of how much less than 5, like up to 5 millimeter or more, a little more than 5 millimeter. Okay, a little more than 5 millimeters. Check for this induration. Okay, if it is there, that means CDI, cell count is high. Okay, 21 days later, you again check for this. You again give this. You check for induration. You check for induration, but this time a small mass, small papule. Check for small papule, which is more than 10 millimeter. If this is there, that means CDI count is high. CDI count is high. It also means that this person, in the early, it means also the person has been exposed. Exposed to leprosy. He has been exposed to leprosy. Okay, now culture is done. These two tests are done. Levenstein-Jensen medium culture is done. Then what is the Malditoff and VTech? AND VTech, ELISA and PCR. ELISA, AND PCR, ELISA and PCR. Okay, then there is treatment. For treatment, you can give Dapsone, you can give linezolid, clofamazine. Isolate the patients, isolate the leprosy patients, because leprosy is a very infective disease. Patients, PATIE, and isolate the leprosy patients. Till then, you can also give them. Okay, what vaccines? Vaccines for leprosy. First is the BCG vaccine. Second is your MIP vaccine. Mycobacterium Indra. It is not Indra. It is Mycobacterium indicus. Prani. Mycobacterium indicus PRANI Prani. Mycobacterium indicus Prani vaccine. Okay, BCG vaccine. Thank you. Okay, go on and say that there is nerve involvement here. Tuberculoid bacillary leprosy. If you can see here, there is no lesions. Nerve involvement occurs early. Nerves are often enlarged. Nerve involvement occurs early. Nerves are often enlarged and thickened. Nerve abscess may be seen. Pronounced nerve damage may lead to deformities of the hands and feet. So can someone explain me why Apurva Shastry did this? Like in the starting, they said there is no nerve involvement, and now they're saying there is nerve involvement suddenly, and there is nerve involvement of the ulnar nerve and all these nerves. Why did they say that? I don't understand. Why did they say that? I don't understand. So can someone just check? Can someone just tell me why they said that? Okay, one more thing is there. Prognosis. Prognosis is poor. POR poor in multivascularity. Prognosis is good. Prognosis is good here. Sorry, prognosis is good here, and prognosis is poor here. Sorry, prognosis is poor for proper vascularity. Multibacillary it is good, and multibacillary there is more than 5, and here there is less than 5, okay, less than 5. Possibacillary has less than 5, this has more than 5, okay. Next thing, we can talk about signs and symptoms of leprosy. Signs and the symptoms of leprosy. Signs and symptoms of leprosy. Signs and symptoms of leprosy. What are the signs and symptoms of leprosy? First sign and symptom is leonine fasces. Leonine fasces. Leonine fasces. Leonine fasces are basically it's like papules on faces, papules on faces. Then there is loss of eyebrow, loss of EYEBROWS, or loss of eyebrows. Then there is bone deformities, deformities. Nerve involvement, in possibacillary. In possibacillary you have ulnar nerve, then you have post-auricular nerve, then you have median popliteal nerve. Nerve involvement exists. The 9 facies exists. What else? Loss of eyebrows, bone deformities, nerve involvements. You will see ulcers and papules. Papules and lesions on the hand, lesions on hand. Complications include allergic reactions called lepra reactions. You have 2 types of lepra reactions: lepra 1 and lepra 2. Okay. So in lepra 1 you have, lepra 2 is possibacillary, and lepra 1 is borderline bacillary. Here ulcerative lesions are present. Lesions are present. ARE present, PARE ACNT. Here erythematous papules are present. Papules are present. PULE. Erythematous papules means it's red color papules. Papules are red in color, and they are called CALLED. They're called ENL. Papules are present. Lepra reaction 1. Lepra reaction 2 happens because of chemoprophylaxis of cancer. It happens because of chemoprophylaxis. This happens because of chemoprophylaxis or chemotherapy. Chemotherapy. This happens because of weak CMI. It happens at the start and end of something.